Good morning and welcome to this seminar entitled Learning Disability Nursing in Research, Making Research Reality. My name is Dr. Warren Gillibrand and I am the Head of Nursing at the University of Huddersfield in the School of Human Health Sciences. I'm very proud to be welcoming you to this webinar. The University of Huddersfield has been commissioned by NHS England to host and deliver a series of webinars to showcase and celebrate the importance of learning disability nursing-led research. This builds upon a previous commission where we hosted webinars to showcase and celebrate the importance of nursing-led research in areas such as COVID-19, end of life and palliative care, and mental health, for example. I am particularly honoured and privileged to present this seminar today because of my history in nursing. In the mid-1980s, I started work in learning disability nursing, indeed started my training, and have moved into various different fields over the last 40 years. And in those 40 years, we've seen a huge shift, not only in the way we work, but also in paradigm and the way that we are underpinned in our practice by evidence-based practice. Today's webinar is testament to where we've moved to in terms of nursing-led research. Before we hear from our speakers, I'm honoured and delighted to introduce today's co-chairs, Amanda Mackay, and Consultant Nursing Learning Disability at Calderdale and Huddersfield NHS Foundation Trust, and Sam Abdullah, Lecturer in Learning and Intellectual Disability Nursing at Edinburgh Napier University. So I will now hand over to Sam. Thank you.
Good morning, everyone, from a very wet and windy Edinburgh. Thank you very much, Warren. As you've said, my name is Sam Abdullah, and I am a learning disability nurse by trade. My background was in community nursing, and prior to that, working with children with complex health needs and profound and multiple learning disabilities. I now lecture at Edinburgh Napier University, and I am also a doctoral student looking at the development of professional identity for learning disability student nurses. And I will let Amanda come in now to introduce herself.
Good morning, everybody. I don't know if you can hear me or see me. I've still got Sam on my screen.
We can hear you.
Thank you. So good morning, everybody. I'm really pleased to be here with you today. I'm Amanda Mackay. I am consultant LD nurse locally at Huddersfield, so Calderdale and Huddersfield NHS Foundation Trust. For the last 15 years, I've actually worked in the acute setting, supporting people with learning disabilities. But here today, I'm representing the UK Consultant LD Nurse Network, and I feel really privileged to be able to welcome you all to this fantastic event we have planned this morning. And we are joined by three excellent speakers who are leading names in their fields. They'll be presenting their research and discussing their experiences of conducting research on today's topic. So firstly, let me introduce Dorothy Kapara. She's a learning disability nurse and senior lecturer and course leader in learning disability nursing at the University of West London. Dorothy's presentation is entitled The Learning Disability Nurse Researcher, My Journey So Far. Our next speaker is Ross Golightly, and he's a learning disability nurse and advanced clinical practitioner at Hertfordshire and Worcestershire Health and Care NHS Trust. Ross will be talking about undertaking research for his MSc in advanced clinical practice. And then thirdly, we'll be joined by Josh Hodgkinson. He's a learning disability nurse and senior lecturer in learning disabilities at the University of Teesside. Josh will be speaking about his early career in research as a learning disability nurse. We will not be taking breaks between speakers. We will be bringing them back all together after their presentations to discuss the issues raised about their research. And I really do encourage you to pose questions and make comments using the Q&A function at the bottom of the screen. So without further ado, I will introduce our first speaker, Dorothy Kapara, and we will see you in a little while.
Thank you, Amanda. Okay, thank you so much for this opportunity. As Amanda said, I'm Dorothy Para, and I'm a learning disabilities nurse by background. Today, I just want to share a little bit of my research experience in learning disabilities research. And I'm also a qualified community learning disabilities nurse or specialist practitioner. I'm also a registered nurse tutor, and I'm also a qualified community practitioner nurse prescriber. At the moment, I'm a PhD candidate at University of West London, where I teach, and my current role is a senior lecturer and course leader for learning disabilities nursing. What I aim to do today is to share my experience as a reflection on my journey as a PhD student, or my research experience, on my PhD journey. Though I've been involved in other research projects, but today I'm just focusing on what I've been doing in my PhD. I've done systematic reviews as part of a team, and I've done other research projects as part of a team. But again, today is just the PhD journey that I'm looking at. One of the things that I just wanted to highlight to you is, why am I doing research? Because it's not an easy thing, but it's quite enjoyable once you get your head around it. I previously worked as an acute liaison nurse in 2 different trusts in London, and the experience was challenging at times. And at the time, again, I'm talking of 2008, 2009, thereabouts, it was still new, and there was a lot that was not known about liaison nursing. So this is one of the reasons that inspired me to do this research. Also, to do research is one of my career ambitions. And also to get a doctor title to my name, as I'm working as a teacher in higher education, though I miss clinical practice at times, and also for promotion purposes because of the nature of the job that we work in, and also to enable me to publish. And also the joy of creating knowledge and sharing it. Little was known about liaison nursing, so I felt this was an opportunity for me to explore this particular role and explain it, and see if it can be improved, as we now know that knowledge is critical for innovation and workforce development, but most importantly, to address the health inequalities experienced by people with learning disabilities and autism. And again, I wanted to improve nursing practice, transform patient care, and also produce effective and best evidence that can be used and influence policy development. And to a certain extent, hopefully to improve or to change some organizational culture when it comes to supporting people with learning disabilities. Also, the other reason why I'm doing research, it's because the opportunity was there as part of my role in the college, teaching nurse education. The opportunity to do a PhD was there, so the timing was good for me. That's why I also took it up. And also, I just wanted to inspire other LD nurses to do research as well, and also to embrace research as part of their role, particularly those nurses from BME backgrounds. And naturally, I like asking questions, so I felt probably research is the best way to go. So before I go into the other reflections that I have, I'll just quickly talk you through the research that I'm doing as part of my PhD. My research question is, what is the role of learning disabilities, acute liaison nurses in acute healthcare services in the context of role theory? This is an exploratory sequential mixed methods study. Why did I use mixed method studies? Because little was known about liaison nursing. Therefore, I was exploring, and I had to do it in stages so that I could have, enough, so that I could touch everywhere. Probably that's what I'm trying to say. So initially, I had planned to do this in 3 stages. But when I presented my partial thesis at stage 1, the examiners at that point said that I had written quite a lot and I was going to have too much information, which was too big for a doctoral thesis. Therefore, they advised that I do it in 2 stages and I could do the other work that I had initially planned as postdoctorate research. So now I only have 2 stages. And stage 1, I did a documentary analysis, which was a qualitative study. I looked at job descriptions and person specifications, and I used thematic analysis to analyze the data. And then the themes that I found from there, I built them into my stage 2, where I administered a mixed methods questionnaire, where I collected quantitative data and qualitative data. And I was looking at the factors that influence how learning disability acute leaders and nurses experience their role, and what are their perceptions and experiences as they enact it. And this was an online questionnaire, and I'm going to talk about some of the experiences and challenges that I encountered when I was doing this. And now I've interpreted the results, and I'm in the process of now writing up my thesis, and I would say I'm almost at the finish line. So that's what I've done so far. So in terms of my reflections, I would say this is how things have been going for me. When I submitted my research proposal and it was accepted, I was very, very excited. The funding was agreed, again, more excitement. And in our university at the time, you'd present your research proposal to a research committee, then they would give the final approval that whatever you're planning to do, it's something that is doable at PhD level. And then you get going. And at that time, again, I was still very, very excited, searching for literature and completing a literature review. And it just created a buzz within me. I really, really liked it. And anyone who cared to listen, I was just talking about my research. I had grand ideas, and I even attended some of the lectures that are put at the beginning of the PhD program. Talk about the philosophical aspect, of research. That is, you're pretty much on your own with your supervisors. I'm not able to say how long did I last in the excitement stage, but I remember enjoying it. And then the ignorance or uneducated phase now started. And when this started, you kind of become fearful. Am I going to be able to do this? Because I started to realize that I had limited knowledge of what was ahead or some of the challenges that were there. I was not fully aware of some of the things that I needed to know. Time management became an issue because I was working full-time and studying part-time. And I also started to recognize some challenges that I had not paid attention to because of the excitement. Initially, I thought it was going to be a very linear process, which would be smooth. But once you get there, research is not like that. It's not as linear as you think in your head. And also some of the things that I did was binge study periods. I would go for periods when I'm just immersed in my research, and then maybe I would burn out or, just leave things again for long periods. So I've learned from that now, but I'm just sharing, those experiences. So after the ignorance and uneducated phase came the floundering and some struggles. I'm just being real here and making myself a little bit vulnerable, but don't worry, there's a good outcome. I knew so little about some things, so I had to find information. I did not know how to use some of the software that you actually need to manage your data. For example, NVivo or SPSS, so you actually have to educate yourself. You have to attend training for you to do that. I was not finding the information that I was looking for. I thought I would just request for job descriptions for my documentary analysis and get them. But lo and behold, it wasn't that simple. I had to use freedom of information in the end to write to Acute Trust in England for me to have job descriptions. And again, that process in itself showed me a lot of what was going on regarding this role. Some trusts were saying we don't employ a liaison nurse. Some were saying they belong to the community, we have no responsibility for them. So it showed me a lot that there is so much that is not known about this role. And on the other hand, life also happened, affecting you personally, poor health, the pandemic came, bereavement, all those kind of things, they added to the struggles. And at one time, doubt crept in, where you begin to think, am I doing the right thing? Should I keep on doing this? Or maybe there are other things that I could do. And being a PhD can feel a little bit lonely. And it can be difficult to continue to be motivated, but thankfully the supervisors were very good. They were very supportive, and I picked up again and found my motivation. So after that, I would say there was some recalibration. I had to learn some things about myself that I had not anticipated. So I had to do that. I had to change the way I think, the way I do things. I have to attend some training sessions, some webinars, conferences, very, very important. And I would recommend this to anyone, particularly those that are specific to your field, learning disabilities. It's an opportunity for you to meet people and network. One of the important ones that I attended was in Glasgow, the ISAD conference in Glasgow. I think that was 2019 or 2020, I can't remember now. And it was an opportunity to meet other people who are interested in research in learning disabilities. And also talking to others, it's very, very helpful. It's not just about you and your supervisors, but find other people to talk to. So after doing that, I was now able to emerge with some confidence when I started to get invitations to co-author on book chapters or on journal articles. I also started to get involved in other research projects, presenting to wider audiences. All those things, they actually helped, and being able to say no as well, knowing how to increase my personal effectiveness. And now we are even talking about submission dates. So the end is now in sight. And once again, I'm excited about my research. So just before I finish, these are some of the benefits of doing research. I'm just sharing this to encourage someone or to inspire someone. Now I'm in a position where I'm even reviewing journal articles as a peer reviewer. And I've met some key and prominent researchers in learning disabilities, and I've learned a lot from them. And I now have confidence in authoring, be it a book chapter or a research or a journal article. And some of the things that I've published, if you follow the link to my staff profile, you can see that critical thinking has been enhanced, and there are also improved prospects for career progression. Contribution to knowledge, which was one of the things why I wanted to do this. I believe I've now done that, and my research interests have grown. And most importantly, I would say being able to influence and enhance practice when supporting people with learning disabilities and to address the health inequalities that exist, being able to improve those health outcomes, improve their health outcomes and feed into policy development, and also just showcasing what we can do as learning disabilities. And again, being considered as an expert are some of the benefits that I've experienced so far in learning disabilities research. And in conclusion, I would say that research is one of the key roles for learning disability nurses. We know that learning disability nurses, they have a checkered past as a profession from the time when they were working in long-stay hospitals, but that has now evolved, and we are now making a positive impact on people's lives, even though there's still room for further growth and to embrace co-production of knowledge by involving people with learning disabilities and their carers. And I know that by doing research, we can influence education, we can influence policy development, and take up advisory roles to ensure that the needs of people with learning disabilities and autism are met, and innovation and, improve quality of care. So I would say that's my submission to you today, sharing my experience on research as part of my PhD journey. Those are my contact details. And I just want to take this opportunity to thank my supervisors for all the support and, most importantly, being patient with me. I think it takes a lot of patience being a PhD supervisor. And I also want to thank the organizers of this webinar series and the opportunity that they've given me. Thank you, Ben Briggs, for remembering me when this came along. And thank you all for listening. Thank you.
Thank you, Dorothy. I found that incredibly interesting, and having worked in the hospital setting for 15 years, really look forward to seeing some of your work published. And I've got a question for you that I'm going to pose in the chat. And I just like to remind everybody, if you've got any questions for Dorothy, please do put them in the chat and we will join everybody at the end. I'd now like to hand over to Ross, who's going to be our second presenter for this morning. Thank you, Ross.
Thanks. Thank you, Amanda. Good morning, everyone. I'll just share my screen. Okay. You should all be able to see that now. Current slide. Yeah. Okay. So good morning, everyone. As Amanda said, my name's Ross Golightly. I'm a learning disability nurse currently working as an advanced clinical practitioner. I've just qualified, quite new in the role, as of about 2 or 3 months ago. I completed the master's programme at the University of Worcester, and I work in the South Worcestershire Community Learning Disability Team in Herefordshire and Worcestershire Health and Care NHS Trust. I'm primarily here today to talk to you about my research project, which I undertook for my Master's Award, my dissertation. But I'm also going to talk a very brief detail in the beginning. I'm going to start with talking about the relevance of research within the wider ACP role. I'm not focusing on that too much because, as I said, I'm quite newly qualified, so I'm not doing a lot of active research as a qualified ACP yet. That will come in time, I'm sure, but obviously I've just come from finishing a 3-year program where I've got a bit more to talk about, so that's my focus for today. So, the definition of the advanced clinical practitioner or advanced clinical practice is there for you to read if you like in your own time. But I wanted to bring your focus to the 4 pillars of practice, and particularly research. Obviously, within the ACP multi-professional framework, they are underpinned by 4 pillars of practice, which are clinical practice, leadership, education, and research. So research is something that you kind of have to engage with when you're studying to be an advanced practitioner. And then obviously it's something that's integral to your role once you qualify. It's not something that you can just kind of wash your hands of once you've qualified. It's something that you're expected to engage in regularly and maintain throughout your career. And you are expected to do active work within the research pillar and evidence that, and obviously keep that portfolio. Within the multi-professional framework for advanced clinical practice, which is aimed at any professional studying, so not just nurses, could be midwives, allied health professionals, pharmacists, etc. There are a series of competencies. The research pillar has 8 competencies, so these are there again for you to read in your own time, but these are as a trainee ACP, it was an expectation that I had to evidence to my clinical supervisor, which was the consultant psychiatrist in my team, that I had met these competencies to a satisfactory level. Then he would sign that off, and I had to complete that by the end of year 2. So it was an expectation of my university course that we would complete the portfolio by the end of year 2, so it didn't even include a dissertation. So projects I was involved with in work during year 1 and 2, and some of the academic work that might have ticked off these competencies were used. And just to highlight, obviously, you got 4.7 there, disseminate best practice research findings and quality improvement projects across appropriate media, such as presentations. Well, that's what I'm doing now. So I can say that today I've done some active work within the research pillar, and I can evidence that. Right, so I'll move on. In addition to the multi-professional framework, there is also the Learning Disability and Autism Specific Competency Framework. It was not an expectation that I had to meet these additional competencies as part of my course, as it was with the previous slide. But this is just to guide me as a qualified ACP what my kind of work should go towards, you know, a kind of additional research work. And for people considering employing an ACP in their service, or for those of you currently training, perhaps, this is just something to be mindful of that you might have to be kind of evidencing and working towards. Okay, so back to kind of the trainee side and with my kind of academic head on, just to introduce you to the research components of my master's level award, which you know, so I know people. I've looked at the participants list. I've seen that there's one or two of you that I know are interested in the ACP role because you've spoken to me about it. So I hope you can get something from this. But equally, if any of you are doing master's level awards in other courses, I'm sure there'll be some similarities here that you can take from this. But as I said, for the research components in my course, one of them was the portfolio pillar, the research pillar. I had to submit evidence to meet each competency, which my supervisor would then sign off. Some I struggle with more than others. So some might have only had one piece of evidence, but some might have had several. And naturally, obviously, there were some pieces of evidence that met multiple competencies. So I submitted the same evidence for multiple competencies. I also had the research methods proposal in year 2, sorry, the research methods module in year 2. And I think that's, you know, I've looked at several master's courses over the years, and I think a research methods module or a significant component of research methods and methodology is almost always seen in master's perspective, in master's curriculums. So yeah, for me, that included the research proposal for my dissertation, which was 2,000 words, and a data set analysis. So we were given piece of data and had to look at that and do a write-up of that. And finally, the final year 3 dissertation project, which was 15,000 words. So my initial thoughts and feelings for my project, if I'm being truthful, I really was not looking forward to it. I think parts of me was, parts of me wasn't. But I thought it would be honest to share that it wasn't all sunshine and the rainbow, similar to what Dorothy was saying about things like the floundering, the struggling, the burnout. That's something I was anticipating and worrying how I was going to juggle that. I work full time. I'm in a 9-to-5 role, so kind of really only left me with evenings and weekends to do this, which obviously ate into a lot of my personal life. So it has a significant impact on, on your life. So it's really something not to consider undertaking lightly. You've got to really kind of prepare for that. The expectation of the commitment. It was twice the length of my undergraduate dissertation, which just seemed completely unfathomable. My undergrad dissertation was 6,000 words, so to suddenly have to go from that to 15,000, just didn't see how that was possible. But then, probably it's in surprising news to nobody, it ended up being way over, and I ended up having to chop bits. So I think that's often the way with some people with work counts, isn't it? So I was worried about how I'd maintain the passion for the research project during the year. Would I get again the burnout? Would I still want to do this? Would I lose passion for the study and wish I'd done something different? And finally, would I feel supported by my employer, my clinical supervisor, and my academic supervisor? Which are all normal doubts in a situation, I would imagine. So just to introduce you to my chosen research question, which is what we're going to focus on now for the rest of the presentation. So what are the experiences of independent and supplementary non-medical prescribers in learning disability teams? I did take a long time to focus on a question. I had loads of different ideas. This is what I decided to focus on because I just undertook my NMP course in year 2 of the ACP program. And I was, really interested in what people around the country that worked as NMPs were doing in their role. Okay, so as a brief overview of my study, it had ethical approval granted by the University of Worcester, and the research team within my trust were aware of the study. And my initial literature review that I did highlighted quite minimal research on the NMP in LD services. I wasn't able to find any data which explicitly and explicitly showcase their experiences. I did find one recent study published in 2020 which focused on a single pharmacist prescriber in LD services, but that was the people that were interviewed were the carers, people that they supported, and other members of the clinical MDT, so psychiatry colleagues, and I think a nurse colleague, but not about what their perspectives was on the pharmacist role, not the NMP themselves. So there were some that were, I did find some other studies that looked at nurse prescribers that worked in LD, but they were many years ago, and they were before nurses had independent prescribing rights, so only when they could be supplementary prescribers. So obviously the experiences of independent prescribers was the name of my study, so I wanted to include that. I use social media to recruit participants. My study was open to any professional in LD that could prescribe, so not just nurses, but allied health professionals, nurses from other fields, and pharmacists. But I think naturally, because I'm a nurse, I'm part of a few LD nursing Facebook groups. I have a lot of LD nurse contacts on Twitter. It was just naturally nurses that saw that and reached out, and also LinkedIn as well. I recruited 6 participants in total. All were RNLD qualified, but at varying levels of practice. Some were advanced practitioners, had 2 consultant nurses. Most worked in adult services, but 1 in children's services. And all prescribed, I haven't put it here, but all prescribed psychotropic medications. Nobody was involved in the prescribing of medications for physical health. It was all things like antipsychotics, antidepressants, things like melatonin and zopiclone, benzos, and I think 1 participant was involved in prescribing ADHD medication as well. I used semi-structured interviews conducted via Microsoft Teams, and in some of the research I was doing about the data collection methods, I found that this was seen as quite a valid method now of data collection, considering especially in a post-pandemic world. And I used the Braun and Clark approach to thematic analysis to generate my themes, which I'll come to on a separate slide shortly. So my personal barriers and challenges during the study process, and my first was participant recruitment, simply because it just took a long time. I think by the time I'd initially got my ethical approval and I posted my recruitment poster on social media, I initially on that same day got quite a lot of interest to the point where I'd have to think I was going to have to turn people away. But then obviously not everyone that said they would contact me did, and it was not possible to follow up. Some people I couldn't contact directly because they didn't have the option to kind of direct message them on Twitter and stuff. So I wasn't really able to follow all those conversations up as such. But some people did, and then I had to send the consent forms, but sometimes it would take a long time for them to come back to me. Some people didn't send them back, so they just obviously decided not to go through with it. So it took a long time to reach my minimum 6 sample. So once I was done with that, I stopped recruitment for more and just went ahead with it. Obviously, I was new to research, so I kind of had this natural doubt that what impact that would have on my study. If I'd been a researcher for several years and published things before, perhaps that would have I would have naturally developed skills as a researcher, and that would have perhaps influenced my interview technique, what questions I asked, how I asked them, the themes I generated. So I'd be quite interested to see how that would have worked out if I studied before. But yeah, so I had that kind of natural lingering doubt in my head as well. And of course, back to a previous slide, the innate fear of how I was juggling this with full-time work and my home life as well, the impact that had on my work, my hobbies, my relationships, things like that. But was able to overcome and successfully pass and qualify, so it was all worth it in the end. So an introduction to my findings. Obviously, this is just the briefest snapshot. So if any of you are interested in more of a robust information about what my findings were, you can contact me separately or perhaps ask in the Q&A. But just for this, so general findings that when training to become an NMP, most RNLDs, the participants fed back that they were often the only RNLD in their class cohort and found little to no LD related content on the course. So I think some of the people that had qualified more recently, they'd heard like the training had briefly covered on STOMP in some minor detail, but other than that, nothing. Participants, sorry, I'm just going to move it because my window is over my window. I can just see me over that, so I'm going to move myself now, sorry. Okay, so participants felt that their RNLD skill set, their predisposed RNL skill set was well aligned to the NMP role, such as their person-centered approach and their holistic assessment skills. So one person even said that they felt that RNLDs were made to do this, and it was kind of a natural progression onto once being qualified. Like other NMPs and other services like general practice, mental health, general hospital work, NMP participants were valued by people they supported, families and carers, and other members of the MDT. All 6 participants were involved in work to do with STOMP to varying degrees. Some of this included developing STOMP pathways, STOMP policies. Some was a bit more clinical on the ground with the running of a STOMP clinic. Sometimes this was on their own, and sometimes it was joint with a psychiatrist. Training and education for other colleagues in the team or carers, and audit work around STOMP. The other big finding was that all participants had experienced family and carer hesitancy when a medication reduction was proposed. So generally this fear about a particular behavior returning if the medication was stopped or reduced. I think that one participant even said that as soon as they'd had that consultation to stop it, the carer had gone back to the GP and asked for it to be put back. So there's a really kind of clear indication there that kind of approach, when you're doing that kind of work, it needs to be really kind of robust, NMD focused, MDT focused, coordinated, and just making sure people are educated on the benefits and the risks in STOMP work. Participants had a role in educating and empowering colleagues in their teams with knowledge of medication. And so for those NMPs that are also ACPs or training to, then that's where things like your education pillar can come into, because you're doing that work as well. So next steps for me as a researcher, I was recommended when I got my feedback, I was recommended to consider this for publication. I haven't really made any headway with that yet, just because I wanted to kind of enjoy the summer holidays, because I'd kind of had no life for several months. But that's something I'm going to try and make some headway soon and see where that goes, and possibly engage in any further research from the recommendations. So in my conclusion, I did say that there were some recommendations for further research, such as kind of widening sample to include AHPs, pharmacists, perhaps people working in inpatient services, because everyone's in the community, and people in children's services a bit more. So yeah, maybe take some of that on myself, maybe not. I don't know. We'll see. Well, that's quite open to that. And I've got support from my academic tutor. Even though I've left the university, I'm still in contact with them to try and maintain. I'm going to maintain that relationship. Top tips for anyone considering engaging in a master's level study, whether it's the ACP program or not. This is just what I found worked for me. Personally, we were advised at the beginning of actually it was in year 2. We had our research methods lectures, and I think this one was about the ethical approval side of it. We were advised not to do studies that involve collecting data from patients directly, because the ethical process was a bit more rigorous, and it would take time. It would just be it would eat into your academic calendar a lot. It could be 2 or 3 months to get that approval back, and then it might not be accepted anyway. So it was much more easier if we did that with carers or with staff. So I got my ethical approval quite quickly once I'd submitted it. Meet with your academic supervisor if you're allotted a particular amount of time. So for us, it was 8 hours across the year. Then use that, go prepared with what you want to ask, and get out of each meeting. My cohort in particular found a WhatsApp group was quite helpful to share resources and tips. But if you think that works for you and you would find that helpful, then go ahead. And utilize the resources on the institution's recommended reading list for the research module. It sounds quite simple, but it is, it's there for a reason. It's there. It's not there to help you. And finally, be clear on the learning outcomes for the research assignment, because that can really trip you up. And if you're not doing that, it could be the best project ever. But if you've missed one outcome, you could fail the whole thing. I think, yes, that is me done. So I'm going to back over to Amanda. Thank you all for listening, and I look forward to taking some questions in the Q&A.
Thank you, Ross. That was really interesting, and I do hope that you don't take too much longer of your summer holiday, and really would encourage you to get that published. And for me, most definitely, I think having a look at ACP roles in physical health, I think would be really, really interesting, and definitely an opportunity that I think learning disability nurses need to look towards. So really look forward to some further research in that area. And without further ado, I will introduce our final speaker, which is Josh. I know Josh, we are both members of the Shared Decision Making Council for Learning Disability Nurses. So I'm really, really pleased that he's here today to share his presentation with us. Over to you, Josh.
Thank you very much indeed. I will just get on with sharing my screen. Okay, so hoping that you guys can see that okay. Yeah, thank you very much indeed for the introductions and to the chairs and to our previous speakers. There's certainly a lot I can relate to, so I hope to share that with you a little bit. So my name's Josh. I'm a senior lecturer in learning disabilities up at Teesside University. I've been a RNLD for just over 12 years now, worked exclusively in the private sector and now higher education, so across kind of a variety of roles. And I've been an academic for the past 6 years. My email and X handle, previous Twitter, is on there, so please feel free to get in touch if you would like. So what I hope to share with you is just a little bit about my kind of journey into research, some of the projects that I've been involved in, and essentially some of the reflections on what it's really been like to get involved in research. I suspect that there's going to be quite a bit that I can relate to from Dorothy and Ross here. So I thought I'd start with something that Dorothy certainly alluded to. So kind of a bit of a question, is it a linear progression into research? Well, that's kind of what I originally thought. And Dorothy captured that very well. On face value, it seems to be quite a funnel approach. You know, you get your broad expertise, knowledge and skills, and then that eventually distills down to something a bit more advanced. So you do your BSc, you get that broad sort of research methods and basic understanding of research to navigate it in practice. You go and do your masters, you build on all of that. You start to undertake research at a novice level, perhaps first time, with a slightly deeper understanding of research methods. You go into something like a doctorate, so that's DRPP, that's the one I'm currently doing. You get a much deeper knowledge of methodology and methods, planning and carrying out your own independent research, and then you become what's known in the field as an early career researcher, perhaps been really involved in research. Fair to say that that is absolutely not the case. My initial expectations of just sort of growing confidence quite consistently and growing my expertise and skills was absolutely out of the window. And I think others can probably relate to that. I think my master's was probably a good example of how I thought it would go, but it absolutely didn't. Trying to undertake research as a student, not being in an academic role, lots of challenges to things like Health Research Authority approval. Once that eventually, got approved, then you come into challenges with things like recruitment, and that threw some real curveballs my way. I think what the other speakers have alluded to as well, that life gets in the way. You're juggling quite a lot in terms of work. I had changing jobs, had a personal life, went through some bereavements, and then the pandemic happened. So life really does throw quite a few curveballs at you. And what I think I learned is that the deeper that I got into research, the more I realized I didn't know. And I then became aware of, oh God, there's probably things I don't know that I don't know. So it kind of gets you into that deeper territory of maybe not understanding as much as you thought you did. Now, I don't want to at this stage just focus on the challenges. I'll unpick those a little bit more shortly. But I just want to reinforce, the benefits certainly outweigh the challenges of research. And despite having gone through some of those peaks and troughs throughout the journey, that certainly didn't put me off to carrying on into a doctorate. So I thought I'd just share a little bit about my journey into my doctorate, if that's okay. So that's kind of where my passion began. So I was raised around LD nursing. I spent a lot of my childhood going into work with my mum. She's an LD nurse too. It was the 90s, so that was cool. That was fine. I used to hang out in the kids' respite unit and the nursing home that she worked in. I heard a lot of the stories between the nurses, which was kind of what inspired me into getting into the field in the first place. But I also was exposed to a particular problem in our field at quite a young age, which I observed throughout my training, subsequent career. And that was LD nurses seem to be a bit misunderstood sometimes. And there's maybe some worrying perceptions from our sister fields. So I thought, right, I need to do something about this. So I wanted to examine that in a bit more of a constructive way than just kind of feeling quite frustrated about it and talking to my nursemates. So I embarked on a doctorate because why not? It felt like it was the right move from a professional point of view, and it gave me a platform to examine some of those problems that I was encountering by looking at the available literature, figuring out what that gap was, and subsequently trying to design and carry out a piece of research to essentially answer that problem. So for me, that felt like a really constructive, practical, professional rigorous way to examine something that had essentially bugged me my professional career and as a child. And really that's what's kept me motivated throughout the journey. Having that initial innate passion to address a problem has certainly sort of helped with keeping the motivation up. I really can't recommend enough encountering something really irritating in your professional life and using research as a bit of a catalyst to try and unpick it. I think as an academic, it's our kind of way of saying, here's the proof, told you so, now what can we do about it? So that was kind of my route into my doctorate, certainly. Now, in terms of some of the challenges, I've had to put the word imposter there in huge letters on your screen. Imposter syndrome has been well and truly part of this journey. From going from a BSc to nearing the very end of my doctorate now, so I'm very close to submitting my thesis and just making some amendments before I do my Viva. It still does feel quite challenging at times. The imposter syndrome is still there. And I'll come on to what's helped with that in a sec. But I thought I'd address some of the elephants in the room. And I think, again, some of our previous speakers have alluded to this. So certainly for me, being involved in research as an academic and as part of my courses, there's been those moments where I've just not really had a clue what people were talking about. You felt like a complete novice again. So going back to that kind of dread of being a first year and thinking, oh God, this is all really new and I don't know the horizon, the landscapes of things like funding, bids, regulations, experience of doing research in a very applied way, that was all very much there. And I think one of the things I haven't put on here as well is that finding the time, and I know previous speakers have alluded to that in terms of, you know, having that juggle of work-life balance and kind of even doing things around your job. So it can be really tricky to fit it in, granted. And what I found is that, you know, everything takes far longer than expected, and sometimes the time frames are really tight. So it's quite a collaborative journey with lots of back and forth. But I thought I'd move on to what's helped. So acknowledging the challenges, acknowledging that imposter syndrome is absolutely there. What have I found that's helped? So obviously I'm in an academic role now, and I think that's been fairly convenient in terms of getting involved in research. I'm exposed quite readily to the research world, perhaps compared to other practitioners, and I don't doubt that's been helpful. It's certainly not the only road in, and I think as a nurse, wherever you are, you're more than likely going to have a link with an academic institution because you've got student nurses that you support. You might well have research teams in your organisations, but I guess this is just specifically what I've found that's helped kind of for me. So certainly saying yes to being involved in projects, diving off the deep end, even as a complete novice, has been helpful. I preach it to my students when they're kicking around on placement, jump in at the deep end, say yes, just go and try it. So I've tried to practice what I preach there, and just being exposed to and having experience in that research culture has provided such a rich opportunity. And looking back, even, you know, my MSc and certainly my doctorate have also helped just to kind of get used to that academic vernacular, that research vernacular. You know, it's kind of like, you know, you undertake a course, you do your nurse training after you've got your PIN, and that's kind of when the real learning takes place. And I guess that's been quite similar for the masters and certainly the doctoral journey as well. The research colleagues that I've worked with, whether they've been substantive in their role or whether they've been research colleagues in practice, I think that's probably been the most helpful tool. They've created a very safe space, and you know, you're able to have very supportive conversations and essentially ask those really daft, really stupid questions in quite a safe environment, just to kind of get your confidence up, and being supported to do that research. It really does help to drown out that kind of imposter syndrome when you're researching with the right people. And it also has exposed you to that, you know, these conversations and projects are very iterative, the back and forth, we have debates. Sometimes even the experienced researchers don't know the answer, and actually that's a really fantastic environment to start to practice researching, because it kind of shows you that real reality of undertaking it, and it certainly made me feel more comfortable myself. One of the other things, particularly for us, is that being an LD nurse has absolutely helped, full stop. What I've found is that in the projects that I've been involved in is that we all have different skills, whether it's project management, whether it's, you know, methodological expertise, but the clinicians, us, there's no single person that could carry out every work package in that research project. And actually, where the majority of my skills have come in isn't because I've undertaken research in a course, it's because I'm a clinician, because I have that experience and expertise on working with people with LD. So I can undertake things like doing patient and public involvement workshops. I have those communication skills, and we've got that clinical expertise to inform kind of research development. And actually, one of the professors that I work with really closely, she's lovely, and she often says that, you know, we couldn't submit half of the bids that we do in our field without having an experienced LD nurse involved. So for me, that really speaks kind of volumes to our profession and kind of why we need to be involved in research. So, I mean, I've been involved in a range of projects, kind of past and current, whether they've been bids, bits of research, and they've been in various capacities. Like others on the call, we've managed to procure some publications. Some of them have been peer reviewed, others haven't, and that's been really good to get involved in terms of looking at non-traditional or non-peer reviewed methods of publishing sort of research and data and findings. It's given that kind of variety and experience. And sort of looking at this summary since 2019-ish, it's actually quite nice to reflect on this journey into research, and it almost provides a bit of a tangible confirmation that actually my confidence and, if I dare say it, competence, that's the imposter syndrome kicking in there, has grown quite a bit. I still consider myself very much an early career researcher, but the important bit to me is that I now feel a bit more comfortable with those discussions, being involved in projects, navigating some of those challenges that we talked about earlier, even if it's just the sort of research vernacular. And I'm going to make a Harry Potter reference here because I'm a millennial. So if you're a fan, you'll remember that there's a moment in the Order of the Phoenix where Harry's achievements are being sort of explained to his fellow students, and he says something along the lines of, well, it sounds great when you say it like that, but most of that was just luck, and I nearly always had help. And that's kind of how it feels like looking at this summary of the things I've been involved in. So whilst it looks a lot like a list of successes, the reality is that, you know, it started out by making very small contributions to very specific parts of research projects, whether that was just being involved in the lit reviews, whether it was just screening papers for whether they're relevant or not, whether it was writing up the odd tiny bit in the sort of research write-up. Every piece of that has been a very helpful tool, whether it's been small or large, even doing things like the analysis, and that's progressed into more substantial roles in terms of projects. And I've even been given a title on the most recent one, which is PPI lead. And again, imposter syndrome, very much strong with that one. So one I haven't put on there is a recent one, and I'll tell you the significance of that in a sec. I recently lost my colleague, sadly, and has sort of experienced some disenfranchised grief in the workplace and among some friends. And the reason that I've shared that with you is that's leading to a discussion on designing a piece of research to, again, like the doctoral topic that I chose, try and address and examine a problem in quite a constructive way, and use research as a catalyst. So I guess the reason I shared that really is to reinforce, and I can't stress enough how important our kind of personal lived experiences are, our professional experience and clinical knowledge and expertise is in being a trigger for a piece of research. So I just kind of wanted to reinforce that a bit. So I guess my final thoughts before I hand back over to my chairs, partially what would I say to the super novice researcher me? I guess make links with researchers and collaborative partners a bit earlier than I potentially did. You know, we've, like I said earlier, there's lots of trusts and lots of academic institutions that maybe I could have just had a bit of a cold approach. Hey, have you got any research on the go? I'd love to be involved. Kind of embrace that novice again. It's been a challenging journey, and it's been scary being a novice, but embracing it has really helped, and having that research culture around me. Find a subject, problem, or area that you're interested in, see what opportunities lie ahead, find that passion of something that you'd like to examine or address, and recognise that we as LD nurses have got that clinical and subject level expertise. We're a really valuable resource in terms of a research team, and we really complement that. And like I said earlier, you know, a lot of research couldn't go ahead without having a clinical expert involved. So I guess the final thought I'd like to share with you is those rewards. I guess for me, it's been, you know, I've been in an academic role for 6 and a bit years now, and actually been involved in research has allowed me to do some direct work with service users again in terms of carrying out workshops. So that's been lovely. It's also allowed me to be involved in projects that help to address a problem in practice and then have, in some cases, quite a direct effect on things like quality of care. And of course, it's been really nice to gain new knowledge and skills, which although it feels nice to do that, has also helped with things like career progression, which I think, my colleagues, other speakers have alluded to. I think it's also helped in me sort of developing new interests and other professional interests. Things like co-production, lived experience have really been something that I've developed because I've been involved in research. And I absolutely very much echo some of the benefits that Dorothy shared earlier, and also Ross. And that is me done. So thank you very much indeed for your time. Thanks for the opportunity. Thanks for our speakers and the organisers and colleagues on the call. And I shall hand you back over to our chairs. Thank you very much.
I mean, we've been using Zoom for what, 3 years now. You'd think I'd remember to unmute myself. Josh, thank you very much for your presentation, and thank you also to Dorothy and to Ross. We are about to go into our question and answer session. So if you have any questions for our presenters today, please do just pop up your hand. And then we will work through you as we see you. We have had a couple of questions come into the Q&A during today's session. So while you all have a think about the deep and difficult questions that you're going to ask us, because I will kick us off with a question from Nikki Genders. And this is a question for you, Ross. There are relatively few ACP roles in learning disability nursing. What do you see as the key benefits of this for learning disability nursing, and how have you managed to connect with any learning disability nursing ACP peers?
Okay, thank you, Nikki. The second part of that question is a bit easy to answer. I think the power of social media can't be underestimated. There are a lot of ACPs on Twitter that I found just through that. There is I can't remember what's it called. Oh my goodness! But there is like a national network of LD ACPs. I think it's a web platform facilitated by I think NHS England, and that's accessible to trainee ACPs or prospective ACPs that are interested in the programme, not just for nurses, but that's for any professional that's undertaking the ACP programme specifically within learning disability and autism services. I think they've met, roughly quarterly, and I've been to one or two of those, and they're usually a morning. That's just good to kind of get a bit of an overview of what's happening nationally, what's on people's agendas, what the role looks like. So obviously it's very different services. Usually people are on their own in their role, in their trust, or perhaps just one or two. It's certainly a minority. In terms of so I'd recommend definitely engaging in that. If anyone's interested in that, I'll have the link, and I can share that with anybody that's interested. In how you just have to register. Just put your NHS email address and what your job is, and if you're a trainee or if you're qualified, then they'll send you the link to join, and then you can be part of that. In terms of the first part, I'm just going to reread that quickly, Sam. Sorry. Key benefits for LD nursing, I guess simply the fact that it's an accessible career option. I think, like Dorothy was saying, we've got a checkered past as a profession. I feel like the validity and the legitimacy of our profession is questioned quite frequently by other society and other professionals. I think just the simple fact that this is an option, it's a viable career pathway, it's accessible. My university were very happy to have LD, that was me and a peer on the course, another LD nurse in my team that were on the course, and they were very happy to have us, and they were really excited and felt that it would really help to develop practice to strengthen the LD nurse role within the MDT. We're looking at, as I said, we're both newly qualified in our role, so it hasn't fully taken off the ground yet, but it's coming. But we're looking at things like having complex case drop-ins, coaching, facilitating kind of one-to-one coaching sessions or group coaching sessions. We did a coaching module in year 2 of our course. So work within the leadership pillar there and the education pillar, and just helping, just using that role and the skills we've developed and the competencies that we've acquired for the portfolio to help strengthen the role and to drive the service forward. I'm sure more. If I think of anything else, I think I've always viewed it more as how it benefits the people we support and how it benefits the service, and less on how it benefits our professions. That kind of stumped me a bit, but it's a good question. But that's where I'm going to leave it for now, but I might come back to you. If happy for Nikki to contact me via email or Twitter if there's anything I can add to that. Thanks, Sam.
That sounds like it's maybe a second research project
Oh,
in
okay.
there, Ross. What are the
All right.
benefits for the profession? We've had a couple more questions come in, so I'm just going to keep working through these. So our first question is from Jimmy Ridley, and I'm going to ask you all to keep this as professional as possible in your response. But any thoughts on ethics? And Dorothy, if we start with you, how did you experience the ethics process?
Almost similar to what Ross said earlier. One of the things that I was told at the beginning, that if you want to get your ethical approval really quickly, try to do a project that doesn't involve service users, which is quite sad, because I would have loved to do that, but it was going to eat into my time. So I would say from that perspective, it's kind of disappointing. But I think postdoctoral research, you would actually do something with people with learning disabilities, of course. So that's the only disappointment. Because again, one of the things that was emphasized to me was you're here aiming to demonstrate that you can follow the research process. Some of these things, leave them for now. Focus on getting your thesis out of the way, then you can start working with people with learning disabilities. So as if my view is, yeah, it's disappointing in that manner because they say it takes a long time. And I didn't come across anyone who encouraged me to, to involve service users or people with learning disabilities. Thanks.
Thank you, Josh. Did you want to add anything to that?
Yeah, I absolutely echo what you've just said there, Dorothy. I think ethics is a particular challenge, more so at master's level in my experience of either doing it or supporting students. And I agree, as soon as you start to involve staff, NHS or patients, it becomes really tricky with the Health Research Authority and it adds huge time frames onto stuff. So I echo very much that it can be a real challenge, particularly at master's level. Not so much of a problem in terms of post sort of doctoral level because you've got that much more fluid time frame. You've got loads more time to plan and get your ethics and stuff in. So I think, although it can be certainly a barrier at MSc level to the types of research that you might do, and it might challenge you to think about doing a less service user focused piece of research or working less directly with service users. I think it's only a barrier for a short time, and the more that you or the more I certainly have experienced the ethics processes, whether it's internal approval, whether it's going through HRA and doing recs, which again can be really intimidating if you've never done them before. The longer that you're in that process, the better your understanding of ethics, the more you've had that exposure to it, the less traumatic as a word it becomes. So yeah, challenging for MSc students, absolutely agree. But don't let it put you off, I think is what I would say.
Thank you very much. And Ross, you touched on ethics in your presentation. Was there anything other than what you've already said that you'd like to add?
No, I don't think. I mean, the university had our best interests at heart. They didn't want us to have to, consider extensions, which we almost certainly would have had to do if we'd gone down that route, because it would have taken. I think they said it could take 40 to 60 working days for that ethical application to be processed, and then it might still be either rejected or they might ask for more info that you've got to then go and collate and send back, and it could be rejected again. So, that's a massive percentage of your academic year just gone. So, and obviously, if you want to qualify and get out there, it was much more simpler to do. I mean, I personally didn't feel I missed out on that because my intention all along was to interview staff because I just qualified as an NMP. But yeah, I think that it is the voices of the people that we support are really underrepresented in research. But I think if you've got a strict deadline, it just isn't viable without having to get significant extensions to your work.
I think there's something in what you guys are all saying around the pragmatism of doing part-time further studies, where your PhD, your master's, whatever it might be, it's about proving that you can do these things at that point, as you said, Dorothy, so you can later go on and spend as much time talking to people with learning disabilities as you can, because let's be honest, that's what we all enjoy doing, really. Questions are coming in thick and fast, and this question is for Josh, and it comes from NSC 76. what do you think the barriers are to learning disability nurses becoming more research active, and more importantly, being able to grow the body of learning disability nurse-led research?
So thank you very much indeed for that question. So I've been sitting thinking about this while others have been talking. I think to answer the first part, what are the barriers to LD nurses becoming involved in research? I think unless you're in a very research active environment, such as an academic role, or unless you are working alongside people who are very research active, I think the biggest barrier is, who the hell do I go to if I'm interested in a piece of research? So I think that for me is probably the biggest barrier that we need to perhaps overcome. I think if you are on some kind of course, whether it's BSc, MSc, doctorate, anything like that, I think it becomes a little bit easier to have the conversation and at least know who to ask. But I think in practice, if that's not something that you're particularly involved in, but you do want to be involved in research in some capacity, I think it is just about trying to make links with either academic institutions. If you, for example, you're supporting student nurses, those academics may have an inroad, or even if you've got sort of people who are responsible for research in your organizations, such as clinical researchers, or anybody undertaking a doctorate, to be honest. I think those are probably the best ways to deal with that. But certainly the biggest barrier for me, I think, is just, who do I speak to? How do I get involved in the first instance? In terms of the final part of that question, so being able to grow the body of LD nurse research, we very well know as LD nurses working in the field that people with LD are vastly under-researched to begin with. That extends to a degree to LD nurses themselves. So I think, again, having that inroad to at least having a conversation with people who and how do I get involved in research, and maybe taking the leap of faith and doing something like an MSc or joining a PhD, despite it feeling very scary. I think that was probably one of the ways in which we can maybe try and combat some of this under-researched sort of culture. So yeah, thank you very much.
Thank you for that, Josh. And I think you never underestimate the importance of the people around you and being able to nurture those skills, because I think anybody, all of you touched on the support and the resilience that it requires to do this study, particularly part-time, particularly as you're working full-time, you've got lives, it turns out outside of work as well. So having people who will continue to nurture that research curiosity and all the way through your programs is so important. So thank you so much for that. Now, if we can answer this question, we might well make a fortune. Matt Perryman is asking us, how do we manage imposter syndrome? Ross, if I come to you first on that, is that okay? It is now, because I've asked you.
That is a really difficult one. I don't think it's very black and white. It certainly wasn't for me. I think, recognizing that it's normal, it's natural, you're not alone. Everyone on your course, even if they're not saying it or open about it, is probably feeling a similar way to a degree. Your course lecturers, your supervisor has been where you've been. So it is normal. But like I said in my talk, they want to support you. They want you to pass. The hours of supervision time are there for you to get that support. So spread it out, use it. If I had 8 hours, for example, so that was roughly like an hour a month that I could meet my supervisor face to face or virtually to really have that check-in and that kind of protected time with him to make sure I was on the right track, that I wasn't deviating too far from my aims and objectives, and it was and he kind of kept me grounded in that respect. Yeah, I think just accept that it's natural. There are lots of other resources out there that can your peers, like I said, the WhatsApp group. It's going to come. I think it's inevitable. But the payoff is worth it. And obviously, you access your tutorials, access your supervisions. They want you to pass, so use that support that's available to you as well.
Thank you, Ross.
Yeah.
And Dorothy, you talked to that emerging confidence that came as you've progressed through your program, and I wonder how much of that emerging confidence became that imposter voice quietening slightly, or at least you learning how to turn the volume down on it.
Yes, I think the emerging confidence has helped me to get excited about research again. And just listening to the feedback that I get from people around me, like my supervisors, or it could be colleagues from, from the team, and, also seeing what I have done, it helps me to, ground me and start believing more in myself. Like, okay, yeah, I'm here. This is what I'm doing. But at the same time, one of the things that I've had to pay attention to is that I need to remain humble and grounded in everything that I'm doing, and not think that I'm at the top of the world. And also, when people come to you for help as well, it's another thing that kind of helps you to realize that, oh, already you're making an impact on other people, and they're seeing you, as support. And also, talking to other people who've done it, see how they've managed it. It usually helps, and that's where the networking comes in really handy. For example, attending the conferences and keeping in touch on social media in a responsible manner, because we're nurses, it actually helps, to keep yourself in check in everything that you'll be doing. Thank you.
And I suppose, events like this where we can come together and talk about the challenges to research, the excitement of doing research, though, because it should be an exciting process, even if it is exhausting. And Josh, I'm just going to come to you for any last tips on managing that imposter syndrome.
Yeah, thanks very much. Just echo what Ross and Dorothy have said, really. I think the thing I've found most helpful, which I probably talked about in my presentation, is surrounding myself with people who were A, very experienced, but B, who I felt comfortable enough to have, very remedial questions and discussions with, and feeling safe enough to sort of share maybe vulnerabilities, anxieties about undertaking research. So I think that for me has been the biggest help in just surrounding myself with people and throwing myself in the deep end. The only way that I've sort of increased my knowledge, I guess, in the research culture, vernacular, undertaking bits and pieces, is throwing myself into it. And that has helped to not silence it, but turn the volume down, as you've said, Sam. So I think that's a really key one. It's still there to a degree, but it's only been turned down by the fact that I've had very supportive colleagues around me, and I've jumped in and kind of put myself in very vulnerable situations from a research point of view. So I think that for me has been the biggest help.
The messaging coming through from what I can hear from you all is, no person is an island, and it's accessing that support that's going to help keep you through this. But also, as Dorothy, as you said, that external validation of you're doing fine, you're achieving your milestones, people are approaching you to work on these other pieces of work. That's recognition that other people believe in you, even if sometimes it can be difficult to believe in yourself. Mark Adamson, who is in the last month of their apprenticeship learning disability nursing degree. Congratulations, Mark. Enjoy the last month of your program. I've struggled throughout due to being dyslexic, despite having lots of support. Would you recommend doing my master's if I get the opportunity? I feel very passionate about doing the very best I can for the patients I support. Dorothy, if we come to you on that one.
Yes, I would say dyslexia shouldn't be a barrier for you to pursue your interests. I would definitely encourage you to go for it. One thing that I can say is most higher education institutions at the moment, they've got strategies in place to support students with learning needs. So as long as you've got the passion, the commitment, the time, and you want to do it, I'd say go for it. Dyslexia is not an issue. You can be supported to do it. Yes, of course, you have some challenges, but it's doable. Reasonable adjustments can be made for you. That's what I can say to support you.
Thank you very much, Dorothy. And I think this question is for Ross, just based on the context, but again, it comes from Jamie Ridley, asking, in terms of publications, is there anything in particular that any place in particular you've considered publishing your work?
Oh, no, not yet. I mean, I've got a lot of significant editing to do first. I mean, it ended up being close to 16,000 words. So I don't think that, I've got to, cut that down a lot before I think somebody will accept that. But know if anyone's got any recommendations, if they think anywhere I could send that to, then I'm going to meet with my supervisor initially first, have a discussion about what the options are and how we go about that. He's going to help me co-author and edit it, and so I need to meet with him to discuss some of the logistics there. I mean, I've been a subscriber of the learning disability practice for a long time, since I was a student nurse, and I've kept that going since I've been qualified. Oh gosh, 9 years now. So that'll be good. But no, I haven't really approached anyone specific, any editorial board specifically as of this time.
And I follow-up question on that for both Josh and Dorothy. Please feel free to come in. Are there any tips that you would offer for people like Ross who are looking to publish? Anything that you would consider?
Yes, from me, one of the things that I've been trying to do is, instead of publishing in learning disability targeted audience journals, I know that might sound a little bit, challenging for some to take it in. Think about the other side, the other people who don't know much about learning disabilities, then try to target those. Just as an example, you could think of, British Journal of British Journal of Clinical Practice or something like that, as opposed to the learning disability practice journal, because I'm thinking people who read those journals, they're already converted, if I can put it that way. So you're trying to convince other people outside learning disability. So that's my way of thinking, and that's what I recommend. But if you don't have any luck there, it's still okay to consider learning disability journals. They're also waiting for research from us. Thank you.
And I guess just to stole the words right out of my mouth, Dorothy, absolutely agree. So yes, it's partly to do with publish within our own field of practice, because that's where we tend to look for a lot of our, clinical evidence. But one of the things that we're not quite as good as doing is infiltrating other areas of practice. So it might be that the community of practice, i.e. who it's relevant to, may well be learning disability nurses. But if it's, research that's situated in general practice or general hospitals, well, there's a whole community of practice of people who clearly need to know about it there as well. So it's looking at trying to publish outside of our comfort zone in our field. And I guess the other question thought I'd pose is, does it have to be a peer-reviewed publication? We're starting to think a lot better now at non-standard routes of disseminating knowledge, whether that's through very informal means like specialist websites or blogs, or journals that aren't necessarily peer-reviewed, but they are discussion pieces, or even things like books. So I guess my other challenge would be, is it just peer review that you want to publish in, or is it also looking at some other routes? So I guess those are my kind of thoughts.
There's a challenge for you, Ross. You can do your master's dissertation as a TED Talk instead of publication. But no, I think the absolute wisdom in thinking, well, how do I get this messaging out to non-learning disability practitioners, which actually takes us beautifully into a question from Dr. Saliari, who was looking to ask you, Dorothy. You talked about some of your emerging findings being related to not knowing about the role of the learning disability liaison nurse. It would be interesting to know if you had comments also related to minimal knowledge about learning disability nursing as a whole, and how did you explore that?
Yes, it was quite evident in my stage 2 when I was looking at the qualitative findings, that there's limited understanding of the role of the learning disability liaison role, because of what the participants were saying in their responses. I was surprised to find some liaison nurses in some hospitals, they're actually expected to support patients with personal care and bedside kind of care, because in that hospital or in that organization, they're thinking, we've got a learning disability patient and a learning disability nurse, so it's their job to come and support a patient with learning disability. Yet that's not the role of a liaison nurse from what we are trying to achieve in acute trust. So yes, there is very limited understanding of what a learning disability nurse does. And also out there, again, people think we're just there to support people with learning disabilities, but they don't realize we're also there to support fellow professionals to raise their awareness on the needs of people with learning disabilities so that they are able to support them without the need of a learning disability nurse, by their side. And also, the other thing that I found, which was kind of worrying, is job description is one thing, but what happens in practice is another thing. So the thing now, one of the recommendations that I'm likely to be making would be around: do we need job descriptions for liaison nurses, or we just need role descriptions as opposed to job descriptions, simply because of what they are doing? I hope that answers you, Sally. Thank you.
Thank you so much for that, Dorothy. Do we have any more questions from our audience today? No? I just have one more question for the group, if that is possible then. I guess my final question would be, what tips would you give to somebody who is looking to undertake some further study or some research about that balance? How do you maintain your own well-being throughout the process? And Josh, we'll start with you, because I've made Dorothy start too many times.
That's okay. And that's a really hard question to answer, isn't it? I think any undertaking of further study that involves research as an additional component is always going to be a really tricky balance to manage. I think from a work point of view, the approach I've always taken, and again, it's slightly different in an academic role because there's time to undertake that. You're given often time in workloads, but in some jobs you're not. But I think one of the tips I might suggest is that, have that open conversation with a line manager, have a look at the policy for things like study leave. I've supported many MSc students who have been doing advanced practice around their full-time jobs, and in most cases they've been able to have a bit of a negotiated conversation with the line managers, get a bit of study time so that it's not just eating away at the personal life. There's also some allowance in there from the work life. So I guess I would suggest that as one thing. And I think the other thing that is not exclusive to any particular course or even undertaking research is try and have that time management. I'm a swine for planning out my diaries and months well in advance. Don't know whether that's to do with the academic thing or not, but I made sure, and I still do, that I leave time for leisure and pleasure in my workload and in my personal life where I'm not focusing on my doctorate, where I just want to put it to bed or not think about it for a few weeks. I've got that time and I've pre-planned it and I know it's there. So I guess, yeah, in summary, negotiate some study time if that's a possibility, so it's not eating up all of your work, and plan in advance so that you've still got time to relax and, get on with the personal life that's outside of it. So yeah.
And Ross, I'm going to come to you next.
Yeah, I think in addition to what Josh said, I think just allowing yourself to have that break from it, that guilt-free time. It is, I remember reading the module guide and it said about how many hours of self-study you'd be doing a week. And I just thought, I was doing the maths and I was like, do I even have time to breathe with this? When I've got my 37.5 hours at work and other things, and just thought, how is this possible? But, when I'm, doing 9 to 5, I'd get home, have some food, and I'd only be able to focus for maybe an hour or two before I'd get too tired. And I think, if I'm not going to force myself to sit at my desk and do work, because I'm not going to focus. And if I'm not focused, I'm not going to produce good work. So it's just a waste of time. So just accept the fact that I've only got, 1 or 2 hours at a time to have those productive bursts of, productivity. And then that's fine, and allow that to happen. And then, and if you do want a weekend off, if you want a Saturday off to not do it, to not even look at your desk, not log on, that's, allow yourself that, because I think if you let it really consume you, it's almost quite toxic, and it's you really kind of feel quite negative towards the project, and you just and it's just, you've got to get that balance. It is hard, but then there's lots of support around, even us, I'll be more than happy for anyone that's struggling through that to contact me, and there's lots of support out there. Obviously your tutors, they want you to do well, so reach out if you're struggling. Absolutely.
And then finally to you for this one, Dorothy.
Okay. Thank you, Sam. Just to add on to what my fellow colleagues have said, be realistic about the whole process and start to anticipate some of the possible challenges and see how best you can navigate those challenges so that you can get over. And the commitment as well. You need to be very, very committed. Like what Josh has said, is about managing your time. And from my experience at home, you have to find dedicated working space. It's not a matter of sitting on the couch with the laptop on your lap. It's not going to work. So find dedicated working space. It actually helps. And also find a topic that you enjoy, something that you've got passion for. Because if you don't have passion for it, at times you might find it difficult to be motivated to keep on going, especially when those challenges come. And also keep regular contact with your work. Don't, again, I'm speaking from experience where I was binging on it and then I leave it for weeks and then I come on it. It doesn't help. So keep regular contact with your work. Network widely, very, very important. Like what Ross is saying, speak to those people who've done it, who've walked the walk, and just chatting, you might learn one or two things. And also to realize that it's okay to fail. Some things will not work as you planned, and it's okay. But the most important thing is not giving up. Just keep on going. And most importantly, monitor your own progress. No one else is going to come and say, have you done this? Have you done that? You have to monitor your own progress. That's what I'll say at this point. Thank you.
And thank you very much for that. At this point, if we were in person, this is where I would turn to the audience and you would receive rapturous applause. But unfortunately, some emojis and me clapping will have to do. So on behalf of myself and my co-chair, Amanda, we'd like to thank you very much for your time today, for our presenters, and also for the great questions that have come from the audience. And we are going to hand back over to Warren to see us out today. So thank you very much, folks.
Thank you, everyone, for attending today, and a special thank you to our speakers, Dorothy, Ross, and Josh, for three absolutely amazing presentations about their journeys in research. I would also like to thank Amanda and Sam for being the co-chairs, and also Ben Briggs for hosting this from NHS England as well. I would also like to thank, in the background, our technical support in Andrew Bairstow and Hannah Whitehead at the university, who make all this happen. Yeah. So what I've heard today is confirms my belief that nursing continues to excel in achieving evidence-based practice, and also it also confirms my knowledge that our profession is a caring, courageous and supportive one. And you've heard today in the questions and answers those offers of support, and I extend those for myself as well, for all those budding researchers in learning disability nursing. Learning disability nursing is a key part of our profession, and we all must strive to continue to promote it into the wider public domain. You'll find a link in the chat to a short evaluation that will help us in terms of planning future events. Your views are really important to us, and I'd be grateful if you just spend a couple of minutes filling that out with honest feedback. Please use the survey also to make suggestions for other topics that you'd like to see covered in future events. On the note of future events, there will be another webinar hosted by NHS England around learning disability nursing and research, so please look out for that. And I hope you found the event interesting and informative, and I also hope you leave the event with a sense of pride, which I've already discussed in our wonderful profession. And so on behalf of the School of Human Health Sciences at University of Huddersfield, NHS England, our wonderful presenters and our co-chairs, I would like to thank you all for coming along today, and I hope to see you again soon. Goodbye.